Hello everyone, today we're at Sweetwater Dental Studio in Sugar Land, Texas, and with me here is Dr. Vlada, who I'll be interviewing today about dentistry in Houston, her own journey as a dentist, and some tips and tricks for both patients and dental professionals who wants to pursue dental career in the United States. So let me introduce our doctor and let me give her a word to introduce herself. Vlada.
Hello. Hi, I'm Dr. Vlada Matitsyn, and I'm a dentist in Sugar Land area. And what would you like to know?
I should say that this dental studio differs from other studios I've ever been for the last 4 years in the United States. The amount of technology and equipment that Dr. Vlada has in her dental studio differs. Tell me more about like all this technology and the trends in dental industry that you try to follow and always stay up to date. How do you do that?
We cutting edge the dental practice, so we implement a lot of new technological tools and instruments. We have the same day crown delivery technique, which we use in the milling machines, which we make the crowns right at the spot when we scan the prep tooth and deliver without any temporary crowns. We have the 3D CT scan, which allows me to see the anatomy of the teeth, the roots, and all the anatomical features, and helps me to diagnose better. So the patients coming in with a sort of confusion, they've been in a lot of different offices and they don't know what's going on. So I see clearly, layer by layer, what's going on with the roots, with the crown portion of the tooth, or any pathology can be seen using that. Also, we are laser dentists, so we use a lot of laser technique. It's painless procedure when we prep the tooth for the filling and doing all kind of decontamination, disinfection procedure with the laser. Also, the tongue rejuvenation of people who suffer from halitosis or gum depigmentation with the laser, which I meet my colleagues which in the dentistry field for years and decades, and I never even heard of that. And we're doing a lot of interesting dental procedures with great results.
I've never seen like laser used in such a wide area of dentistry, and the results before and after, and how patients feel more comfortable, less in pain, and they're just surprised not feeling anything after like very complex procedures, after surgeries. I was surprised. I was like, how you should teach me laser. Tell me a little bit more about it, because like, yeah, that's very interesting. I've never again seen anything like that. So tell me more about yourself. So about your journey. How did you decide to become a dentist? Yeah, what inspired you?
I've been only 17 when I decided to be a dentist. I'm from Russia, so graduated Moscow University in 1988. So what made me decide, I believe that the opportunity, the ability to change the smile and see the results right away and make people happy. And I really believe in service. So I just really feel like serving my patients, it's a great opportunity to serve the world in a way, you know. And coming to this country in 1998, I've been practicing in my country for 10 years at that time, and had one of the first private practices in Moscow when Soviet Union collapsed and the opportunity opened up for the dentists like me. I was able to do that, and it was absolutely great experience. And coming to New York in 1998, I decided to continue my career because it's all I know, dentistry. So I became a dentist in this country in 2004, and I graduated New York University College of Dentistry. And since then, I just continue to educate myself. So taking all kind of continuing education courses, and just my scope of a dentistry really wide because I really have an eager to learn constantly. And that's what I ended up learning, how to use laser dentistry, how to extract the third molars, and even being a general dentist. So I learned how to place implants or extract the tooth with a bone graft in the socket. And all kind of surgeries associated with the implant placement.
Yeah, that's actually also very rare that in one place you can get all type of care, like from fillings to implant placement to periodontal disease treatment. Why do you think it's not that common that dentists do different procedures? Because you do, and that's what I like. I want to come to one dental clinic and get the complete care and trust doctors, professionals there. But it's kind of hard in the United States. Whenever you go to a dentist, you know there is a network of professionals, and they send you to someone else to do the, I don't know, extraction, and then you need a filling, and you go to another professional, and it's just annoying because you have to,
That's
like,
true.
as a patient.
So exactly because of that annoying, and I'm trying to wear those shoes to be, you know, in
patient.
impatient shoes, and I think, would I like to go? Like, I come to fix my tooth, and I have to go to extract it, and I gotta go to place an implant in another place, or I need root canal on the other tooth, and I still have to go to another place. So if I do everything here, isn't it like patient's gonna love me? Is it gonna be I'm proud of what I do? No, seriously. Isn't it like more convenient for my patients? And is it more interesting for me to do it all? Yes, it is. So that's why I pursue always to learn more, to learn how to do resection of the root. Whenever the tooth is sick, I learn how to cut the tip of the root and how to clean the area and how to seal it from the back of the tooth and then suture it up again. It's like a minor surgery, but I learned how to do it myself. I don't want it to travel. I don't want it to go from place to place. I want it to stay with me.
Would you mind showing us around?
Oh, absolutely. Yeah. I will be more than happy.
So you guys, we are here at the Sweetwater Dental Studio. Let's go in and take a tour.
Come on in.
Wow, so beautiful.
The way the area was designed to make you feel like home. We have a coffee tea station. How are you?
This
inside, that's my
most...
diplomas. Don't miss that.
Of course.
I really have a lot more, but there will be not enough walls for my diplomas over here.
So we are going to
Studio 1.
Studio 1.
And this is my red Ferrari right here. That's my water lace red color. We have another one and a blue color in the other room.
That's the magic laser that you always use?
I always use for a lot of my procedures.
Perfect.
And then we're gonna go to Studio 2. This is a panel and a 3D CT scan. It just does this machine going around the head, and you just gotta bite on it right here, and it just make an image of your jaw and the entire head in a way, so we can diagnose even for sleep apnea if it's any obstruction of the airways over here in the throat. Open up like this, as you see that. You can see a lot of things. I like to remove those positioning guides in that window to see things better. And I go with the inspection window. And by doing that, I go over here and make the image closer. As you see that layer by layer, I can see the positioning of the roots to the sinus, the positioning of the roots to the canal where the nerve located, or I can see any pathology around the roots by making it bigger image layer by layer, and then by moving this inspection window I can see, do I have the ability to get inside there, remove that guy, would I damage the sinus, do I need to do that or not? In this case I don't have to do that. It's not out, the bone still above that tooth, the tooth is not even partially erupted, and that's the end of the story. That's how we operate using this 3D CT scan. The regular X-ray machine, which is not like a traditional one, a big machine, it's attached to the wall, so it's really easy, it's not heavy, and it's a minimum of the radiation on that one. They really don't need any apron anymore. They used to use that for the thyroid protection, but the ADA decided it's no need. This is machine, which is centrifuge. We're doing the platelet rich plasma. What it does centrifuge the blood, which all of us train to do phlebotomy on a patient whenever we perform surgery. And then we put those tubes inside this machine and centrifuge it and develop like a plasma out of the blood, which we can use for the better healing, for the better osseointegration, when we mix it with the bone graft, and we make a membrane out of that, which provides a really good healing after the extraction for socket preservation and so on. I'm gonna do PRF membrane, we just got it out of a centrifuge. We're interested in that yellow part of that jelly consistency, platelet rich plasma. I'm gonna cut it off a little. I'm gonna put it in here. I'm gonna place it back as a press on top of that. And then we'll make a beautiful membrane out of that. That's just there. A lot of times it stays on that cover on the top of that. Honey, with the little holes from the cover. So now I'm gonna deliver it. And then you can come here. We have another laser machine over here in a studio too. That's my blue Ferrari and another scanner. We do not take traditional impressions anymore. That's what we do. We do scan teeth for crowns, for bridges, for dentures, for night guards. And this is another small laser, diet laser machine, which we use for a lot of different work. Bleaching the teeth, periodontal treatment, pain reduction treatment, after the surgery, after the extractions, and a lot more.
I don't know how people in dental professionals, they don't have this 3D diagnosing tool. Why would you say that it's not so common in the United States?
Very expensive, yeah. But if you have that improvement in your business, in your dental business, in your dental practice, and you really delivers a great quality of dental care, that's all going to be paid off.
Yeah, I agree.
Yeah,
I agree. First of all, it helps you work better and like deliver
absolutely
better results for clients,
and have a confidence and kind of a stress-free dentistry.
Yeah.
Knowing what you're doing, how you're doing that without bringing any harm to the patient. Yeah. Not like taking the risks like, oh, what if I perforate the sinus? What are you going to do then? Or if I perforate the canal or deflecate, what are you going to do that? And it's a stress on the dentist. Yeah. Every time you're touching any area where it's close with anatomical structures like that. So it's a stress-free dentistry in a way.
For someone who is not sure like if it's worth opening their own business, should they start working as part of an existing clinic first, and then like for aspiring dentists who are just starting, what would you say?
I would say that a couple of years is a good idea to work with someone else to learn the business from the inside, because unfortunately in the dental school I graduated two, one in my country in Russia and another one here, they do not teach you no finances, no business really. So I would suggest for the dentists who just graduated and starting their own career, so start learning the business from the inside as they start delivering the dental services. And then don't wait the 13 years like I did, but 2 years should be enough, to decide what kind of a dentist you want to be, what scope of a dentistry you want to practice. And then just, they say location, location, location. So you're going to choose the right location when you know that the people are going to see you, that the people are going to come in, maybe just seeing the building with your name on it, like we have. I made all possible mistakes which I could have made. So don't do that.
How?
I think it's just education. Educate yourself. Take those continuing education courses on finances, not only on the dentistry, before you become the entrepreneur and the practice owner. Learning process is very important. So, unfortunately, I learned after I started the practice, but even then, I learned based on my mistakes. But I'm still growing and I'm still moving forward. And I would say today, in a couple of years, I really believe it will be no debts on the practice, and it will be, even easier on my shoulders aside the financial part of it. But it's definitely worth it having every single piece of equipment I have in my practice. I would do it again. I'll never regret it because without it, I don't see myself a dentist I am today.
Can you name a few maybe organizations or people who can inspire others and just other dentists can learn from?
Yeah,
Maybe
one
follow?
Canadian I just mentioned, Dr. Carla Biasucci, and Dr. Garg. He really changed my career. I just started like a rocket and went from here to over there because that's the doctor who taught me how to place implants, how to do sinus sleeve, how to do any complicated extraction, including the wisdom teeth extractions, and a lot more. I started taking his classes, his courses in 2011, and I'm still in contact. We have a titanium group of doctors, which we learn from each other how to run the most successful business as well. It's amazing. We're getting together for 3 4 days for that, and it's such an energy and such a beliefs in yourself and everything. So it's just no way not to follow people like that. That your vision to be successful, and you'll be there. And all of us have their own practices, so we exchange the experience and skills and help each other how to run a more successful business.
Let's say someone who is in school right now, what should they think about starting now to be more successful after graduation?
Make up
Any
your mind what
advice?
you like in the dentistry more. Your passion is endodontics, so your passion is pediatric dentistry or prosthodontics. So you want to do everything like me. I want to do a little bit of everything. After making that decision, it will be much easier to continue kind of in that path and just be open minded and be ready to learn every day. The more I know, it feels like I don't know nothing, and that's the only way to go, because really it's absolutely an endless process. I think the dentistry is the most exciting profession, one of the most exciting profession, unless you don't like it. I love it.
I
That's
can
all.
feel it. I can feel it.
Suction. So after you put this, obviously she cannot put the suction inside there because otherwise it's going to be sucked in fully. Okay. So it's pretty convenient. The only thing I usually have the all different calibers of this. And this set I have only one, but they might work pretty good though.
I texted her, a very random person from nowhere. I texted her asking for a shadowing experience because I want to see how American dentistry operates and how a doctor does her job, like also, treating in business. Like, it's a lot. And she was like, "Oh, I'll be happy to." Yeah, I came and she was so welcoming, sweet, and she teaches me a lot. Like, a mentor, and I feel that you love teaching, and I would say that
Yes.
I can feel it even from your assistant. I can feel that you love
I
giving
do, I do,
away.
I do. That's true. So I think it's just like knowing something, I cannot keep it to myself. I really want to share that. And I will share with my colleagues. I want to share with my assist. I want to assist and understand why they assist and what kind of procedure we're doing right now. So I don't want them to be like technically delivering the material product or just so holding a section over there without understanding why and what we're doing in particular. So that's why I'm just always kind of, articulating what we're doing, why we're doing, and it's for the patient. It's easier to be in a dental chair knowing why the doctor doing that. Why? Okay, what is the spray in the air right now? Why is just pouring the water in my mouth right now, right? Or why I feel that, why I feel the sour taste, or why I'm whatever it is, right? And the same thing, because Anna's gonna come and work with me in 3 years. Watch me, watch her.
That's how she builds trust. Actually, we found the secret.
Over here, follow me. And this is our sterilization and the room where we clean the instruments and make the bleaching trays and firing the other type of a material crowns in that firing unit. It's called programmat.
So this is where all the cleaning of the instruments is happening, right?
Yes.
You make sure everything is sterilized and in a
nice and clean. That's correct. That's correct.
Oh, the milling machine.
The milling units. So we're able to make the crowns the same day. So we have all kind of different blocks, as you can see that. So out of that block, even in spite of the funny colors, to white or really violet or blue, whatever you say the color is, it becomes a tooth color. Right after that firing, I showed to you that programmat. But first, you're gonna put in that unit. These burrs make the tooth out of this block, and after the firing, it fits the tooth like a glove. It's amazing.
What about this machine?
It's doing the same thing.
So one wasn't enough.
One wasn't enough. I can do 2 crowns at the same time for 2 different patients. There is no waiting period. And now my favorite room, I opened it up just recently. So there is another room for doing any kind of surgery, any big job. That's my favorite scanner, because as you see that, it scans a lot more because it has the platform of a bigger surface. Yes. And that's how we scan it. It appears on the screen. And from that machine, we design the crown and send the image to that milling unit, and that the crown comes right out. After firing, we cement the crown into the patient's mouth. Another gadget that we have here, that's the oral cancer screening light and the glasses. So when I put those glasses on and I put this light on, can you turn off the light? You can see that? Can you turn off? Yeah. With my glasses on, you can turn it on again. I can see things in the mouth, in the dark, which cannot be seen with a bare eye.
Okay.
At all.
Can you turn the lights off again? And through the glasses, you can see any pathology that's on soft tissues.
Yes.
If there's any. Okay.
Yes. Yes. On the tongue, especially underneath the tongue, on the hard palate, and all the way around the cheeks and the lips area inside the mouth. Yes.
Perfect. And how often do you use it?
On the new patients, once a year.
So that's kind of a basic standard to use
standard
that tool.
care in this
studio.
Yes.
Yay! We should always say that. For the last 2 weeks I've been here, I saw people coming to you from different states. Today we have actually one of our patients that I'll be interviewing her too. So she came here from Hawaii. It's like 7 hours flight to get a dental care. What's the secret of having this type of relationships with the patients, that they trust you and come back?
Well, I think that's exactly the same thing as one day you kind of feel the care we provide and heart which we put into that, me personally. So it's hard to, start looking for something else like that. I think that's kind of, if you're happy, you don't look for the same kind of happiness elsewhere, right? She probably, if you're gonna do it, she's gonna tell you more about it.
We'll hear
Why?
from the
But
first hand.
the trust isn't in the word. The trust that if you trust that doctor and you know that you're going to be extracted because there's no any other way, right? You trust the doctor.
How do you build
I
that
trust the doctor.
Maybe it's your secret and you don't want to share. It's okay.
I mean, it's just I'm just honest. You probably can feel it.
Yeah.
I don't hide it. I mean, I'm honestly telling you the truth, and you take it or not.
Yeah.
I guess that's what it is.
Lena is a patient of Vlada, and she came here to get her dental care. You are visiting us from Hawaii.
That's right.
I know that there is a story about your first appointment with Vlada. How did it happen? What brought you here?
Had a tooth emergency. A nerve under a crown died. I was in a lot of pain, so I went to see a doctor in New Jersey, and he recommended extraction. And I wasn't sure whether that was the right way, and he was not necessary. It was the first time that I saw the doctor, so I called Vlada, and she said, come over. I have the kind of equipment that most offices don't have, and I did, and she saved the tooth. I needed 2 crowns that were manufactured in minutes here at the office. It's a fascinating process to see how the machine, just basically creates a model right out of a porcelain. Vlada's hand, like as a professional, I get to trust her hand. It's caring, but it's firm. It's really, she knows what she's doing. I've always felt very comfortable, a lot of trust. That's how we, first met here at this studio, a studio when she already had her own business. And this time I didn't come for a cleaning. I had a problem with the crown that I needed fixed, and something more was diagnosed, and we had to make a decision. And she performed an extraction yesterday, which was, I assume, complicated because I had an infection also. She used a laser to clean the infection, and then she used 2 types of fillings to build up the gum to prepare it for an implant that I will come back in 4 months to do. Procedure was done yesterday. I'm free of pain today. I haven't experienced any pain, though I was taking the medication now.
You look amazing for that complicated extraction. You see, there is no swelling, nothing.
And I had a little bit yesterday. Yeah, I had a little bit of a swelling, yeah. Maybe even from injections, because there were several injections that I was given for the pain. But yeah, I mean, it looks really good.
Laser does magic with soft tissues. How it helps to reduce inflammation and work the healing process of the gums. It makes it so smooth, and also helps to kind of recover better and quicker for a patient. Is there anything that you would like to highlight in the clinic itself? Was there something else that caught your attention that made you feel different compared to other places?
Well, I'm a loyalist, right? So it's, this is my go-to for complicated procedures, mostly female team, and they move in sync and they move gracefully, and that's how they work too. It's very friendly, it's very caring, smoothly and seamlessly. The work is planned out, right? You're just moving from one space to another space. There are always enough assistants, and everything goes very smoothly, and that just adds to that sense of trust and just assurance that everything's going smoothly, everything's going good. As a matter of fact, I shared with Vlada yesterday that there was this a period of several minutes when I, with this by open mouth and like so many people just looking at it, and so much is going on, and at some point I just fell asleep.
I saw it.
I was just it's which is very unusual, because these experiences are very stressful.
And I think that's the best compliment for a dentist, when the patient gets
falls asleep in a chair, right?
Yeah. It's not about only dentistry, right?
Right.
It's more about a person, her values, and things that she brings with her.
Right.
What would you say about her?
I think she's very authentic, the way she's in life, she's with her work. She's a fighter. She's a courageous woman. right? She is a business builder. She's taking risks. You know, she is the only person in charge of this facility, which has what, like 8 rooms, and you know, a lot of staff and a lot of expensive equipment that she needs to consider, continue mastering, because every time I come in, there is something new because the industry moves along. When it's authentic and when it's real, it makes patients very, very comfortable. That she's fully invested in this. That's her life, really.
Yeah.
That's her life.
As one of my mentors told me that dentistry is not your work, it's your lifestyle. So now you're fully immersed. Like wherever you go, it's a networking. You have to like talk to people, tell about yourself, like everything. Do you like to tell us more about yourself?
I'm an immigration attorney. I've been doing it for 24 years. I'm helping people in all 50 states. I located in Hawaii. I have a team of people working for me. We're about 6 people. Pretty much do all kinds of work. I sort of have a little bit more specialty into people of extraordinary ability, or people who have some interesting endeavors that are in the interest of the United States. I also do a lot of family immigration. Recently, a bunch of asylum cases, immigration court, or agency. So that's what I do. And if anyone's interested, I don't know, I have a website.
We'll just share information, Lena's information. If everyone needs help, she's there to help.
Yeah.
Right? Thanks for coming, and thanks for sharing what you know. What patients can do to make the most out of their visit to a dentist, how to prepare maybe, or how to be confident that they're in good hands. Can you give some advice?
You look at the patient and you have only 1 minute to have that impression on that new patient. You have it or you don't. So unfortunately, you're not gonna know how much I do know, how much skillful I am, or anything like that. But I think it's something when you're looking at my eye and you trust that person, you can stay with that person. I really believe so. But definitely come every 6 months for the checkups. Don't think if it doesn't hurt, it's everything okay in your mouth, because it might be not. Unfortunately, you'll be lucky if there is no problem. But it's good to come in for the regular 6 months checkups and a cleaning, and start from there. Because a lot of times the caries is very cunning and baffling and hidden somewhere in between the teeth. You don't see it without the special x-ray examination, diagnostic x-rays.
So what are the most common dental concerns that patients come to you? What would you say is your favorite? And what is the most unique that you offer that most of the dental clinics around cannot probably offer?
Well, most of the concerns, do you have any cavities? And a lot of times patients not even aware they do. And a lot of times they're not aware the cavity went so deep inside without even breaking the tooth yet. But it needs more than just the filling, but filling inside the roots, which we call the root canal treatment. But my favorite, smile makeovers, or just patients with the missing teeth to restore their smile with the implants and sort of a prosthesis based on the implants. I love that. And as far as the unique procedures, I think that's what I mentioned before, the laser treatment of the tongue, which we call tongue rejuvenation. And the patients would suffer with a lot of plaque over the years on the tongue, and that's what we can remove with the laser. And it's like any chronic disease. You cannot really treat it, but cure it, but you can treat it to get to the remission stage. And my unique procedure, which I do not that many dentists even know it can be done, the gum bleach or gum depigmentation. Those patients who have pigment in the gums and do not like it when they smile with the white smile, we can remove that pigment with the laser and make the gums how they desire to have pink color. And it's really great results.
And how how long does the procedure take? Is it like one time?
It's one-time procedure, but it takes a while to heal after the laser treatment because it does take that pigment away, and it takes about week to 2 weeks to heal and to let the new tissue grow, which will be a desired color pink.
Nice. We should thank our doctor, Dr. Vlada.
Thank you.
Again, Dr. Vlada Matitsyn. For anyone who is looking for a good dental care, the dental studio is called Sweetwater Dental Studio. It's in Sugar Land, Texas, part of Houston, I would say, right? Sugar Land. So, all right, Dr. Vlada.
Thank you so much.
Thank you.